When people show me that they can adjust themselves, or I hear their family member or friends adjusting their spine, I immediately cringe. It's like a reflex. One moment, this kid twists their neck, I'll be like, as a chiropractor. So I feel frustrated about their spinal health, for this bad habit is absolutely destroying their spine. To understand this fully, you need to break down the difference between adjustment and what is manipulation. So manipulation, anyone can twist, anyone can create the sound, thinking that these are steps to set the bone. However, nothing gets done that way. It's not a push in, push out method. Plus, if you have all your postural dysfunctions to begin with, nowadays we see a lot of changes in spines due to technologies, children facing the computer a lot of time. And if we spot on the sides, there are segments that are weakened or degenerated. You try to self-correct this. You try to twist it on your own. What happens? You may not be targeting the correct segment at all. You are actually affecting the weakened area to be more jammed up, more locked, and the surrounding tissues, stiffness, all the signs and symptoms will show up. So it is oftentimes backfire process where joint starts to block up, and then you might feel the movement and pain, and immediately you develop yourself a bad coping mechanism. Why I say that? We hear mothers complaining that children are doing multiple times a day, 7 times that by 7 days, close to 50 times a day, they are twisting their own neck or twisting their own spine. Compare it with a trained chiropractor who analyzes your spine professionally, take into consideration your patient findings, visualize your spinal structure x-rays, and then we can pinpoint only areas that are needed to be adjusted, such as here or here, and some cases the upper cervical spine as well. Then you are able to specifically address the subluxation. So this comes to a point where we want to know, in chiropractic school, there are certain angles that are available in terms of whenever you have scoliosis. The spine can curve in certain way. This one we do not know by mere looking at a children's spine or an adult spine. So scoliosis oftentimes are undetected. Now, we look through how whenever the spine is crooked, some can deviate one side or the opposite side, and then the child or the adult try to twist in the opposite direction. So first, you're inducing a lot more rotational component to it, and immediately your muscles will guard up. So it becomes like a cycle. The child feels pain, then they try to twist. Wrong segment, opposite segment. So pain, child twist, body gets very smart, it hands up, guards up everything, and the cycle continues. The child feels pain after 10-15 minutes. So when you let this happen, a few things will show up. The child might need to create more pressure just to hear that sound. However, is he doing it in a correct way? Is he introducing more injury? We can tell by how the posture gets worse, how without fail the parent is nagging the child, stop doing that, improving your posture. All these are very classic things that we hear in our office. Another example, oftentimes I see people twisting their own neck. However, this is the hardest segments to adjust, and we need to be very delicate and precise due to how close the brain and the spinal cord is. Say, if we detect the spinal segment that is subluxated onto the right side and it is in a lateral movement, add that with its right side. We need to also take into consideration the anteriority or the superiority of things, then we need to position the patient well. We need to, as a doctor of chiropractor, we need to stand properly, and then we need to induce the proper vector specifically to correct that segment, to restore this neurobiomechanical health towards the spine. Now, let's say, for example, you have yourself or someone untrained and they don't go through this detection of the subluxation. You take the neck in, say it's jammed in this way, you yank it, you just twist it on the opposite direction again. Now, you're introducing more and more problems there. And actually, you're creating more of an issue with two very clear reasons. Number one, you're adjusting the wrong segment and further causing surrounding muscles, ligaments to suffer. How so? They would, by very smart, your body would try to tense up to stabilize, and you start to see your posture getting worse. Number two, hypermobility. Becoming unstable is what I mean by hypermobility, and excess motion. Doing this so many times throughout the week, you start to develop a laxity where your spine is too flexible. Why? Potentially you're doing damage to a healthy joint when the spinal segment is stuck here. And remember, we spoke about some unaddressed postural issue. So you are causing the spine to be even more imbalanced in the whole posture system. So this is why there are chiropractors who know certain ranges of the facet joints, where the displane line is specifically sitting. And those who do not go through chiropractic school and do not analyze your subluxation precisely will not be able to locate and adjust within these normal biomechanical ranges. So if you take a joint and you go beyond that actual normal range, you create more damage. And think of it as an unnatural, repetitive movement that you're doing. Plus, if you're applying and yanking in a high force, it's equivalent to you doing like a big acceleration to a wrong direction, opposite segment that can cause injury over time. So, remember that never manipulate your own joints. You don't want it to exceed the load tolerance that a normal tissue can actually withstand. Number two, remember, never let your brothers, family, or anyone who does not have a proper chiropractic license or certificate to manipulate your joint. We are aiming for specificity here, and we want you to get a specific chiropractic adjustment. And if you like, make sure that you see a specific chiropractor that does a thorough x-ray, a thorough exam, and then you're able to compare and case correlate your spinal condition in order to fix it properly for you.